First, I realize that you're not going to be able to know everything about spinal cord injury. It's complex and we're unique patients, but I do expect you to read my chart at least and understand my history and what a spinal cord injury is. I also expect you to listen to me so that I can develop trust in your care. I expect you to listen that when I say something is wrong with my body, that you would believe me and then find ways to integrate that into my care.
I've had many medical students and doctors think that I'm a para because my arms work. And it's not true. I'm a quad because my hands don't work. So I would like them to know that my medical diagnosis before they come in. And I'd also like more training in the wound care department when it comes to spinal cord injuries, with doctors and wound care nurses working together on what causes them. And it's not always people sitting all the time. It can just be really bad skin issues or having major flap surgeries.
A wound vac is not a good idea on lower extremities. I've tried it twice and both times disastrous results. Number two is when I was in the hospital being treated for sepsis, osteomyelitis, and cellulitis caused by a wound vac, I got two sores. One on my tailbone because I was propped up with a pillow there, and that gave me a sore because the skin there is very, very weak for most paraplegics. Secondly, for all you technicians out there, especially MRI, you have to protect our heel, especially for long tests. My heel wasn't protected, and I got a pressure sore on my heel that I'm dealing with right now. So those would be my main concerns.
If I'm being referred to you, I would really like it if you knew a little bit about me so that I didn't have to repeat the trauma that I've already been through. I also would like you to speak to me face to face instead of having your back to me and typing on your computer. And I would really like it if you could help us get the equipment that we need to prevent some of the complications that go with having this spinal cord injury so that we can stay out of the hospital, stay out of your practice or your office, and that we could have better quality of life. And I'd just like to see you do what's right for your patient.
I want to emphasize how important it is to have properly fitted equipment. Having a wheelchair that is suited to the specific needs of a person is very important. It will help them to adjust to a new way of life. It will help them to do all their daily activities that are needed. It will help them to lead a more productive and a healthier lifestyle. Imagine if you had to go through life wearing a pair of shoes that were either too small or too large. It would make everything you do more difficult and more painful.
I wish that more doctors would acknowledge that keeping track of our weight is a very important thing for people with spinal cord injuries because how much we weigh can affect skin breakdown issues and whether or not our wheelchairs fit our body and our needs anymore. And most medical offices I know don't have the ability to weigh us. Nonetheless, it's a very important thing when it comes to our health.
Physical therapy, physical therapy, physical therapy. I wish doctors knew how important physical therapy is, not just the life-saving skills of being able to go up and down curbs, get back into your wheelchair if you fall on the ground. That's important, but what's more important is just not dropping us spinal cord injuries because our progress isn't happening quick. My progress has been slowly getting better, but I have to pay for physical therapy on my own if I want any sort of activity-based therapy. Please consider activity-based therapy, ongoing support and help. We still have bodies that can recover and need to be strengthened.
Understand that this injury comes from a place of loss. Every change physically and every new medicine, from our perspective, seems like we're losing more. Give new news and new diagnosis with this in mind. Consider a DEXA scan soon after injury to monitor bone loss. Also think about bisphosphonate use sooner than later. Understand that continued nutritional support is needed with meal plans, grocery lists, and cooking directions for patients and their caregivers. We know nutrition plays a role in our overall health, but it also plays a role in skin and wound healing and bowel program results. Understand that outpatient PT is just as important as inpatient PT. Self-care, dressing, transfers, and bowel programs are very important, but so is FES, standing, and movement. Lastly, in regards to bowel programs, I understand that doctors prescribe what they know. Do research. Learn not only about traditional bowel programs, but also paristene, C-costomies, as well as colostomies. Push for research on bowel programs and their effects on microbiome and intestinal flora.
What I would like for healthcare professionals to know when working with people with spinal cord injuries is to take us seriously when we say there's something wrong, even if we can't identify what it is. We might use different language than you're used to, such as, well, I'm sweating and I don't normally sweat, or I'm having spasms and I don't normally spasm, or I feel a pain, but I can't identify where that pain is. It has to be a process of elimination and not just blow us off. And we need to work together to figure out what the cause and the problem is. Just because we don't necessarily have sensation doesn't mean we can't feel things.
I just want to bring attention to the fact that there's less and less handicap spots because a lot of doctors are prescribing handicap placards to maybe people who don't really need it. I need the extra room in a handicap spot because I need room to get my wheelchair in and out of my car.
And not being able to regulate my blood pressure has been a huge problem. But then on many occasions in the emergency room and hospital stays, both times they kept trying to medicate me for blood pressure, and I have to refuse that. I have videos where, you know, I'll be spasming, my blood pressure will be shooting up, and I'll be in the 250s, and then 30 minutes later, I'm down at like high 50s, low 60s, you know, wanting to pass out. I can't take medication. It just, for blood pressure, it just throws me off. So every time they start prescribing medication, I have to refuse it, and then they start calling me a difficult patient because I know what it's going to do to me, and I've had ER doctors actually get angry with me for refusing to take the blood pressure medication.
So having low blood pressure normally, sometimes when it raises too high, and I'm in the hospital, they want to give me medicine to counteract it, to bring it back down to normal blood pressure. But because I don't have normal blood pressure, if they give me that kind of medication, it's going to dump my blood pressure really bad. And then they're going to have to counteract it to raise it up. So being a quad or even a para, just monitor us, please, before you give us the medications. That way, maybe our blood pressure can stabilize on its own.
Make sure that there isn't anything wrong when we're hurting. However, if there's nothing else that they can do for us for our pain, the best advice that we need is advice on exercise and diet and other alternative health, because rather than pharmaceuticals. So what else can we do with our diet and our care besides medications in order to feel better and to be the best that we can be?
I've been injured for 3 years, and I've been trying to get involved with an epidural stimulation program for nearly 2.5 now. I live in California, and there is nothing in this region that really offers the clinical trials of which I've been searching for, whether it be epidural stimulation or transcutaneous stimulation. I currently have been accepted back east to the Kessler Foundation in Jersey, and it would just be really nice if there was more opportunity here for quadriplegics like myself. But unfortunately, none of the hospitals around here have the programs of which I've been seeking. I've heard they've done amazing things, and I've talked to people who've been implanted who've regained a lot of function and mobility to some extent. But I just wish it would be more accessible to people like myself.
As a Pilates teacher, I have the unique opportunity to follow my clients on a long-term basis, following them through changes in life and changes in priorities as they navigate life 5, 10, 15, and even 20 years post-injury. Something that my clients often talk about is how important it is that their recovery and wellness programs evolve with them through their changes in jobs, interests, family situations, schedules, so that they always feel supported in whatever feels important to them at that point in time. Especially after COVID hit, my clients in the SCI community were very much requesting programs that they could do from home for obvious reasons. And as a Pilates instructor, my brain immediately went to floor-based programming and working through exercises that they could do relatively independently without skilled clinicians by their side and with simple props like a Pilates ball. Really what we found was that this modality opened our eyes to what our clients wanted in the first place. They wanted to be able to be less reliant on medical equipment and specialists and more independent in their movement programming. This model allowed recovery programs to fit into their lives as opposed to being consumed by it. And I think this example of floor-based programming and even remote coaching is just one example of how unconventional recovery options can be life-changing for your patients. And it doesn't end with me. I appreciate the eagerness of personal trainers and Pilates teachers and yoga teachers and all of these people in these professions willing to open up their services to support people with disabilities, your patients, so that your patients can enjoy movement post-injury. I believe that we are an important step in your patient's continuum of care and return to life. And knowing about options and these professionals in your community is an important part of your job so that you can recommend them to your clients as they leave your hands and they can continue to build on the work and the life that you started with them.
Well, when I talk to clinicians, many people don't realize that people with spinal cord injuries aren't the same as the normal population. So I use the analogy, white ducks are normal, and I am a purple duck. I'm deafened, and you can't treat me the same way. Although most clinicians try to do it. And I have had bad outcomes because of that. So keep in mind that people with spinal cord injuries are purple ducks, not white ducks.
Thank you all for your continued willingness to learn and support the SCI community.
Thank you.
Good luck. Thanks.
Thank you for your relentless work in supporting your SCI patients.
Thank you.
Thank you. Go in peace.
Right on.